Hello class, my name is Tammy Gaden. I'm from Greensboro, North Carolina, and my presentation today is on empathy in healthcare. The article I selected is titled 10 Approaches for Enhancing Empathy in Health and Human Services Culture. It is written by Mohammadreza Hojoat, was published in the Journal of Health and Human Services Administration in the spring of 2009. As we learned in our textbook in Chapter 5, empathy can improve the patient-provider relationship by building trust and can provide a deeper understanding of the patient beyond clinical knowledge. It's not only beneficial to patients and providers, but also all of healthcare staff, administrators, managers, executives, institutions, and the general public. Empathy in clinical care can lead to positive patient outcomes and greater patient satisfaction and compliance, can lead to lower rates of malpractice litigation, lower cost of medical care, and lower rates of medical errors. The article discusses 10 approaches that can enhance empathy in healthcare. I'm going to discuss 3 of those today. First, I want to give you the definition of empathy as defined by Hojoat. In patient care, he defines it as predominantly cognitive attribute rather than emotional that involves understanding rather than feeling of experiences, concerns, and perspectives of the patient, combined with a capacity to communicate this understanding. It is also important for us to distinguish the difference between empathy and sympathy, because both concepts can lead to different and sometimes opposite outcomes in patient care. Generally, empathy leads to positive clinical outcomes, while it's suggested that sympathy in excess can be detrimental to the provider's objectivity when making healthcare decisions. So the first approach is entitled Improving Interpersonal Communication Skills Approach, offering educational programs, training programs, focusing on 3 basic communication skills: recognition, exploration, and acknowledging. Trained physicians can recognize empathic opportunities, which can lead to better patient understanding. When you recognize a patient's emotions, experiences, and concerns, then you explore those emotions, experiences, and concerns, and finally acknowledge them, gives the patient a sense of understanding. There was a randomized clinical trial at Johns Hopkins University School of Hygiene and Public Health where 69 physicians were assigned to 3 groups. 2 were experimental groups and 1 was a control group. Experimental groups received 8 hours of communication skills training focusing on those 3 concepts. The results showed that empathic skills of the physician who participated improved significantly without increasing the time spent with the individual patients. Another approach that Hojoat suggests is role-playing approach. There were aging games that can be simulated. Studies have been performed with medical students that simulate certain conditions, for example, often present in elderly patients, like hearing loss. They would wear hearing earplugs. Arthritis pains, they could put popcorn kernels in their shoes and simulate arthritis pain. So a study done with youth students at Purdue University School of Pharmacy, where they were assigned to simulate the life of an underserved patient who had chronic medical conditions and also had an economic burden, cultural differences, and a communication barrier. Results showed that students increased empathy skills, became more sensitive to the patient's conditions, and developed a better understanding of the patient. Basically felt that they understood the patient after they could walk in their shoes. Another approach is called hospitalization experiences approach. Sharing common experiences can increase empathic understanding. So providers who have experienced pain or hospitalization, it's suggested have a better understanding of their patient's pain. A study performed at the University of California, Los Angeles Medical School using medical students who had no previous history of hospitalization were admitted to a hospital under an assumed name. The patients reported that the experiment was useful because it enhanced their understanding of patient problems. And interestingly, when the students were doing their ratings, they actually rated the nursing staff more favorable ratings than the physicians. So a few discussion questions. What are your reactions to the approaches Hojo suggests that could enhance empathy in healthcare? Do you feel these approaches would be effective in enhancing empathy in healthcare? Would you be able to apply these approaches in your healthcare practice? Would you have the resources? Establishing educational and training programs could be fairly easy. As doing aging games or simulating role-playing games may be a little more difficult. So in conclusion, enhancing empathy in healthcare can improve overall patient care and satisfaction. It's not only beneficial to patients and providers, but also all healthcare staff, including administration and managers. I feel it's a very important concept that organizations need to focus on improving their training to be beneficial. So I thank you for watching my presentation, and I look forward to your feedback.